my name is Vanessa. I'll be your student nurse practitioner, and today we'll be doing an assessment on your abdomen, your musculoskeletal, and your neurological assessment. Patient is alert learner times 4, his GCS is 15. He is a 32-year-old looking male. He is well appearing, his hygiene's intact, and then his skin color, we're gonna do inspection of his abdomen. Skin color is brown, which is normal for his Latino heritage. And then we're gonna move on. Patient's noted to having scarring from the abdominal surgery for the gastric sleeve, and then he has some striae, which is from gaining weight. And then his abdomen, you could tell that it's symmetrical, but there is some distension because of his obesity. Hair distribution on his body is normal and within normal limits. So now we did that, we did inspection. There's no bruising or abnormalities near his umbilical or anywhere else on his abdomen. So we're gonna move on to auscultation. Auscultation, we're gonna cut the abdomen in 4 based on the umbilical area. So ideally you would listen 2 to 5 minutes in each quadrant, and 5 to 35 beats or vowel sounds per minute is normal. But for video purposes, we're gonna move a little quicker. We're gonna use a diaphragm to listen. Patient has normal active bowel sounds, and also just to go back a little bit, patient does not have any visible peristalsis or any visible pulsations from his vascular system. So now after we did that, we're going to also auscultate the aorta, and then the renal arteries, the iliac arteries, and the femoral arteries. We're listening to see if there's any bruise. We're going to use the bell. All right, no bruise heard on auscultation, so that's within normal limits. We're gonna move on. After we did auscultation, we did inspection. Now we're gonna do percussion. Normal for the abdomen is tympanic. There is hyperresonance near the umbilical area, and we're gonna move to all the quadrants. We're listening for tympanic. We'll hear dull near the liver and the spleen, which is normal over solid organs. Patient has tympanic sounds in his abdomen, and hyperresonance around his umbilical area, which is normal. So now we're going to measure the liver, which is on the right upper quadrant, and we're going to go from one below the umbilical to the tympanic sounding to dull, and then hyperresonance from the lung to where the dullness is heard to measure the liver span. All right, dull is heard right there. We're going to mark it. All right, and now we're going to go from resonant sound. Perfect, so we heard the dull right here. Now we're going to measure with centimeters. Patient's liver span is 7 centimeters, which is normal. 6 to 12 is a normal, healthy liver span. So now we're going to percuss the spleen. So for the spleen on the left upper quadrant, it's behind the lower intercostal space, which might make it a little difficult to hear, but if the patient has an enlarged spleen, then you would hear the dullness. But for a normal person with a regular spleen, it would be tympanic. Can you take a deep breath, sir? All right, out. Perfect. So the patient had no dullness. We only had tympanic, which is a normal finding. So we're going to move on to palpation. We're going to use one hand for 1 centimeter for light palpation, or just feeling all the quadrants for any pain, rigidity, masses noted, which are not noted for this patient. So we're going to move on to deep palpation. We're going to do 2 hands, and we're just going to go a little deeper to each quadrant, as long as the last quadrant of pain, if there was, would be done last. Patient has no masses, no tenderness, and no facial expressions of pain noted. So now we're going to palpate the liver. So we're going to have one hand supporting the patient's costal margin, and we're just going to palpate. Patient does not have any pain or tenderness noted, no masses noted. So now we're going to go to the spleen area on the other side. Again, we're going to, as long as the percussion was normal, we don't want to have the bleeding of the spleen if we palpate. We're gonna take a deep breath. All right, now. All right, patient does not have any pain or tenderness and no mass is noted. So now we're going to move on to the patient's kidney. We're gonna have the patient stand up, face the window. All right, thank you, sir. So now we're gonna inspect for any bruising or tenderness on the patient's kidney area, the CVA, which is none noted. There's no bruising or redness noted. So we're gonna do a painless jolt in the kidney area. There's no noted pain or tenderness noted. So perfect. So we did the abdomen. Now we're going to move on to the hip area. We're gonna have the patient lie on his side. All right, so we're going to feel for the iliac crest, which is right here. And we're gonna go down just to make sure there's no pain or tenderness going down. And then for the iliac crest, we're gonna go back to the sacral joint down here to the greater trochanter of the femur, which is intact, and then the ischial tuberosity also. The patient had no noted tenderness, crepitus, or step-off. So now the patient's gonna turn to the other side. Perfect. So feeling for the iliac crest again, we're just going down to see if there's any tenderness or pain to the sacral joint, and then we're going to feel for the greater trochanter of the femur, which is intact, no pain, tenderness, or step-offs noted. And now we're gonna have the patient stand up. All right, so we're gonna test your hip range of motion. So we're going to have you bend to one side. Good job. Bend to the other side. Oh, great. And then we're going to have you go to the left. Keep your legs straight. Perfect. And then, great. All right. So now we're going to have abduction and adduction. So you're going to take out one leg, pull, and then cross your legs. All right. Patient was able to do that smoothly. And now to the other side, abduction and adduction. Great. So that's within normal limits. So we did the abdomen. We did the hips. Now we're going to have the patient sit down. So his range of motion of his hip is intact. So now we're going to inspect the upper extremities. We're looking at the clavicles, the shoulders, and the neck, which are all symmetrical. And then we're going to look at the back of the scapula. There's no step-offs or abnormalities or bruising noted. So now we're going to palpate. We're going to go to the sternal notch. And we're going to go to the sternoclavicular joint and feel the clavicles. And then we're going to go down to the shoulders where we're going to feel the coronary process and the AC joint and the greater trochanter of the humerus. And that's all normal, and there's no step-offs or crepitus. We're going to do the spinal scapula and the trapezius. There is no pain or step-offs noted. Now we're going to do this side as well. We're going to do the sternal notch, sternoclavicular joint, the clavicles, and we're going to move down to the AC joint, the coronary process, and the greater trochanter of the humerus. And then we're going to feel the trapezius, and we're going to feel the spinal, the scapula. There is no pain or tenderness there. So now we're going to move on to range of motion of his arms. So we're going to bring your arms up and then go behind. We're doing abduction, and then we're going to do adduction, go behind your back. Perfect, no pain or tenderness, and he was able to do that smoothly. So we're going to test his elbows. So we're going to do 90 degrees, and then we're going to flex, and then we're going to extend. Great, and then now we're going to do 90 degrees. Perfect, and 90 degrees. There you go. And then we're going to hold your strength. All right. All right. So that was within normal limits as normal, symmetrical, and bilaterally. So we're going to move on to your reflexes. So we're going to do your brachial reflex. So you can relax your arms right there. We're looking for a painless reflex, a little jolt. Perfect. So now we're going to do the brachial radialis. And patient has 2+ for his reflexes. So now we're going to try the triceps reflex. We're just going to pull his arm 90 degrees. And that's what we're looking for, a brisk reflex, 2+. Great. So now we're going to do pulsations. We're going to palpate his pulses. His brachial pulses are bounding, +3. And his radial pulses are +3 as well, which is all normal. So now that we did those, we're going to move on to inspecting his hands. We're looking for any redness, any inflammation seen. There's none on this hand, and there's no open areas. On this hand, there is some healing abrasions, but no signs of infection or inflammation. And then we're going to palpate and look for any swelling in the metacarpal joints. And then we're also going to make sure to assess the snuff box, which if there's a fracture in his hand, then there could be some bleeding and can cause necrosis, which would need follow-up. And that was normal. So we're also feeling this hand as well, the snuff box as well. No pain or tenderness. Fingers are sensation is intact, and his capillary fill is less than 3 seconds. So that's all with the normal limits. Now we're going to test the range of motion and strength in your hands. So you're going to flex, extend, and then the thalamus test. That would ideally be for 1 minute, but for this, we're going to move on. Patient has no signs of pain or tenderness. And then we're just going to test your strength. Can you push up? Your hands, flex them. All right, extend them down. Perfect, that's normal and bilateral hands. So we're going to move on. We did the hands, we did the hips, now we're going to move on to the lower extremities. So we're going to inspect first. Both legs are same color, no bruising, no abnormalities noted. There is a scar noted on this leg that's healed, and then we're going to move on to palpation. So we're going to feel from the quadricep down to the patella and the tibia, make sure they're flat, and fibula, and then we're going to go lateral aspect, make sure there's no pain or tenderness in the tendons or joints, which none are seen, and then we're going to go posteriorly to see if there's any pain or tenderness on palpation, which patient is normal. So we're going to move to the other leg, start at the quadricep, move down to the patella and tibia and fibula to make sure there's no swelling or step-offs or any abnormalities. Laterally as well and posteriorly, which are none seen. No pain or tenderness? Perfect. So now we're going to move on to the reflexes of the lower extremities. We're going to do your patella. We're going to have his legs dangle off the floor. Perfect. And then this leg. Great. So that was with the normal limits. He was able to see that little jolt that was with the normal limits. So we're going to move on to his feet. So patient's feet, we're going to inspect them first. No bruising, no numbness, no swelling noted to either leg. So we're going to palpate the medial malleolus and then the lateral aspect of the malleolus. Then we're going to feel the talus, and then we're going to feel the metatarsal joints to see if there's any tenderness or swelling, which are none noted. Patient has less than 3 seconds cap refill on his feet. We're going to check the Achilles tendon in the heel, which is smooth, no abnormalities noted. We're going to feel for the DP pulses, which are +3, they're bounding, which is with the normal limits. So we're going to test the reflexes, and we're going to test his Achilles tendon reflex. Perfect. And then just a small jolt. Great. Now we're going to check the plantar reflex. We're going to have the patient have his leg up. We're just going to make sure that he's able to have that reflex where he's able to crunch his toes. Perfect. So we're going to flex your feet, make sure that the strength is equal bilaterally, and then push down. Perfect. And plantar extension too as well. That was with the normal limits. So those are with the normal limits, the lower extremities. So we're going to move on to the spine. We're going to have the patient stand up. All right. The patient posture for the assessment was normal. He was able to hold himself up, which is all with the normal limits. So we're going to have the patient turn around. All right, perfect. So we're going to have the patient flex down to touch his toes. What we're looking for is the spinal column is midline, and then the paravertebral muscles are normal, and the transverse process is normal. There's no bulging or bruising or discoloration noted. Patient's midline. So we're going to have the patient stand up, and we're going to extend back. Perfect. All right, so we're going to have him bend to one side. Good job. And then the other side. Good job. And then turn. Put your feet, yeah, there you go. All right, patient has full control of this posture. Now we're going to have to do the neurological exam, sir. We're going to sit down. Now we're going to do the cranial nerves. We're going to do cranial nerve 1 the olfactory, which is smell. So we're gonna have you close your eyes, occlude one there. All right, please tell me what you're smelling.
Orange.
All right, occlude the other.
Orange.
Perfect. So that's with the normal limits. Now we're gonna move to the optic vision during the visual fields. So you can look at me, sir. So you're gonna cover one eye. All right, so I'm gonna cover the same eye. So you tell me how many fingers there is in each field.
1, 2, 1, 2.
Perfect. Now we're gonna occlude the other eye.
1.
Look at me.
2, 1, 2.
Perfect. So that's what the normal is. That cranial nerve is intact. So we're gonna move on to the cranial nerve 3, 4, 6, the ocular, trochlear, and abducens. We're going to do the 6 cardinal gaze. So you're just gonna follow my pen light. All right, perfect. So he was able to follow, and there is no nystagmus. Now I'm going to look at the patient pupil and the iris. They're both brown, and his eyes are, the pupils are equal and brown. And now I'm going to test the concentric light. He was able to constrict while the light was shining in one eye. Now we're going to do convergence, so you're going to follow the pen light. He was able to accommodate, which is all with normal, so those cranial nerves are intact. So we're going to move on to the trigeminal nerves, facial sensation. All right, sir. So we're going to tell me if this feels the same.
Soft. Yep, soft.
Perfect. So we're going to move on. I'm going to palpate your face and temporal and the masseter. There's no step-offs, no crepitus. And now, can you open and close your mouth? Perfect. So there's no clenching of his jaw, which is with the normal limits. So we're going to move on. With the vestibular cochlear, which is cranial nerve 8, which is hearing acuity. We're going to do the Weber test, which I'm going to strike the fork, and you're going to tell me if you hear it on both sides.
Okay. Yes.
All right, perfect. Now we're going to do the Rene test, where I'm going to put the tuning fork behind the masseter bone. You let me know if you don't hear it anymore.
No.
And then let me know if you no longer hear it.
No.
All right, so the point of this test is to make sure that the air conduction is actually greater than the bone conduction.
No. No.
Perfect. So that's with the normal limits for the patient. So we're going to move on to the cranial nerve 9 and 10, which is taste and swallowing. All right, so we're going to look at the patient's mouth. Can you say ah, sir? All right, so the uvula is midline, no redness or swallowing noted. We're going to test gag reflex. Perfect, so that's intact. Patient's going to drink some water. This cranial nerve is intact. He's able to control secretions and oral secretions and drink the water smoothly. Perfect. All right, so now we're going to test cranial nerve 11, the spinal accessory, which is going to test your trapezius and your sternocleidomastoid muscle. So can you shrug your shoulders? All right, he's able to do that with resistance. So we're going to turn your head one side.
Mm-hmm.
All right, push against my hand for midline. Great, and now the other side. Great, so that's with the normal limit, so the cranial nerve is actually intact as well. So we're going to move on to the hypoglossal tongue motion. Can you stick your tongue out, sir? Can you push my tongue blade? There you go. This side. Great. So can you stick your tongue out into your cheek? Good job. And push against my hand. Good. So that means that cranial nerve is actually intact as well. So we're going to move on to the RAM, the rapid alternate movement test, where you're going to put your hands on your thighs, and then you're just going to go slap your hands up and down, smooth, fast. Good job. So that's perfect. So that rapid alternate movement is intact. So we're going to move on to the leg dystaxia, where he's going to put his heel on the opposite leg and run it down. All right, and then the other leg. Good job. So that's intact. He's able to do that actively and smoothly. So there's no issues there. That's with normal limits. Now we're going to do painful and sharp, superficial pain, dull, and keep his eyes closed for the extra reception test. So tell me if this is sharp or dull.
Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. 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 Sharp.
Perfect.
Dull. Sharp.
Great, so that's within normal limits. So we're gonna move on to the temperature. You're gonna keep your eyes closed, sir. You tell me if this is cold or warm.
Cold. Warm. Cold. Warm. Cold. Warm.
All right, so that was intact. So we're gonna move, that was the extrareceptive. Now we're gonna do the proprioception. We're going to have your hands and toes. You're gonna let me know which side is up or down, if it's your finger or toe.
Toe up. Finger down. Finger up. Toe down.
All right, perfect. So you let me know. I'm gonna sharp the tuning fork and see if your vibration is intact.
Toe. Toe.
Perfect. So that's within normal limits. We're going to move on. That was your proprioception. Now we're going to do your cortical stenosis for familiar objects. All right. Can I see one of your hands? Keep your eyes closed. Can you tell me what's in your hand?
Feels like a coin.
Perfect. And then the other hand?
Feels like a key.
Perfect. So his cortical stenosis is intact. Now we're going to keep his eyes closed and do a number and letter in his hand. Can you put your hands out?
B.
Perfect. And then
3.
great. So that's within normal limits. So we're going to move on now to graphesthesia. We're going to do the 2-point. And then, sir, I'm going to put 2 points on your hand, and then you let me know when it becomes 1.
Okay. 1.
Perfect. Okay.
1.
All right. So his 2-point discrimination is intact. Now we're going to do the extinction. So I'm going to touch both sides of your body, and you let me know when you only have 1, or what if I'm doing 2 or 1.
2. 1. 2. 1.
Perfect. So the extinction is intact. So we're going to move on to walking. All right, sir. So you stand up for me. You go right there.
Good.
All right. So you're going to walk normal towards me, and then to your heels toe. Perfect. And then you can go back, and you're going to do on your tiptoes. All right. Perfect. So now we're going to have your eyes closed. All right, so we're doing the Romberg's test to see if there's any swaying, which the patient does not display. Now we're going to bring your arms up and you extend them, your palms up. All right, so we're looking for the pronator drift, which the patient does not note. And now the patient is done and we completed our assessment. Thank you so much.